Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So this is the picture showing relative afferent pupillary defect, where we see first we will show the light on one eye. So when we show the light on one eye, it contracts. When you show the light on the other eye, so if this is the normal eye, it contracts. But on diseased eye, when you show the light on the diseased eye, it will not contract, it will dilate. So this is relative afferent pupillary reflect. Again, on putting the light on the normal eye, again there is meiosis is seen in the normal eye.
thank you and thank you for watching.